guys can come in and fill in the seats in the back there. Thank you. All right, well, good afternoon and welcome to the Treasury Building. This is the home of the Comptroller of Maryland and the State Treasurer's Office. And to acknowledge our Treasurer, Derek Davis is here. You'll hear from our Comptroller in a minute. My name is Ben Siegel, and I'm the Deputy Comptroller for Policy, Public Works, and Investment. And we're gathered today for the release of our new report on baby bonds in Maryland. We have copies of the report on the resource table out in the hallway. We have fact sheets. You can grab them there. You can also download the report at marylandcomptroller.gov/research. Before we jump into our program, I wanted to share some of what's in the report. First, before getting into that, I wanted to acknowledge the General Assembly, and especially Delegate Mark Edelson, who sponsored legislation last session that turned into this study that we did. Unfortunately, Delegate Edelson couldn't be with us today. He's in court. He's not in trouble. That's where he works. He's a lawyer. But we do have some other members of the General Assembly with us. I believe Delegate Wims is here. We have Delegate Ziegler. I think we have some folks online, so let's give them a round of applause for attending. And there's a lot of excitement for baby bonds in our legislature. I have a couple of brief slides that I'm going to go through just to give a little bit of background on the report, and then we'll jump into the program. So if we jump to our first slide. So in the report, we look at the feasibility and financial implications of implementing a statewide baby bonds program in Maryland. I think everyone here knows what baby bonds are, but for those who don't, you'll be hearing a lot throughout the day. But very briefly, baby bonds are government-funded trust accounts for children that grow in value over time through investment earnings and are intended to be used for asset and wealth-building purposes when the babies become adults, for things like purchasing a home or starting a business. The goal of baby bonds is to build economic security and generational wealth and to close the wealth gap. As you can see, we did in the report a scan of baby bonds programs across the country. And you can see the map here that there are a number of states that have passed or are considering legislation around baby bonds. To date, Connecticut is the sole state that has passed and is now implementing a baby bonds program, which went into effect in 2023. And you'll hear a little bit more about that one on our first panel. In the report, we also did some modeling. If you jump to the next slide, don't worry about reading all these numbers. They're all in the report. But we did a bunch of different modeling looking at various scenarios relating to eligibility and building in various assumptions on what a baby bonds program could look like in Maryland. I'm not going to walk through all of them, but I just want to briefly share one of the examples. So in the report, we looked at the scenario where if we enrolled the roughly 30,000 babies born per year in Maryland under Medicaid coverage, and we did that over a 5-year period, it's 150,000 babies enrolled in the program, then with a seed investment of about $550 million, we would result in having $50,000 per beneficiary by the time the babies reached age 30. And that would be substantial enough to put down a down payment on a home in Maryland. There's a lot more on the numbers in the report. We get into different administration scenarios on how the program could be run. Please read the report, check it out. We're happy to follow up with folks to talk through it. But first, we're going to jump into our program. So we have 2 panels for you. Our first panel is going to talk about some of these programs at the national level, some of the best practices, and then we're going to talk about some of the activity happening here in Maryland on the second panel. So with that, I will call up our first panel, Comptroller Lierman, New Mexico Treasurer Laura Montoya, and David Radcliffe, who is the State and Local Policy Director at the New Schools Institute on Race, Power, and Political Economy, and he was also one of the architects of the Connecticut program. So guys, come on up and we'll get started.
Thank you so much, Ben, and welcome, everybody. I'm Brooke Lierman, the State Comptroller. It's such a pleasure for Treasurer Davis and I to welcome you to the Treasury Building of Maryland. We're excited to be able to do this work. I also want to give a shout out to Delegate Edelson and to the Appropriations Committee and Budget and Taxation Committee, who included this language in the budget this year in the Joint Chairman's report to request that we complete this study. So we were honored to be asked to do it, and a very willing partner. Thank you also to two people who are coming to Annapolis for the first time, I learned. Our great treasurer from New Mexico and David Radcliffe from the New School. Welcome, welcome. I am really excited to have this conversation because these are two people who know very clearly what baby bonds mean. They have been working at the national level in different states, from David and Laura in New Mexico, to really dig in on the details and model out and plan for true implementation of a program. So to get this conversation started, I want to talk about baby bonds as a policy, because the concept has been around for quite a while, but it's really just started gaining steam in the last decade or so. And the idea of being able to close the huge racial wealth gap that we have in America and increase economic security at scale is really the promise of baby bonds. And I think especially today, as we are seeing decreased economic mobility across the country, as we are seeing, involved in this true affordability crisis, when we're seeing things like, the average age of a first-time home buyer now is age 40, when 20 years ago it was in the 20s, right? That the real challenge that young people and that increasing generations are facing, and baby bonds could be a real solution to some of that. So, David, let's start with you. Tell us a little bit about baby bonds, how they're intended to work, and your background in this.
Thank you for the question and the opportunity. So I'm going to answer your question in three parts. And I'll start first with a question that my institute's founder, Derek Hamilton, the economist and baby bond architect, often asks. And the question is, what is the purpose of an economy? And think about your own answer. And as I talk about it, to our values and to our way of thinking, it's allowing people the resources they need to lead lives that are prosperous, self-directed, and hopeful. So within that aspiration, within that larger framework, you can see how an elegant, powerful, potentially transformative policy like baby bonds rests. And as Ben talked about, baby bonds simply are publicly funded trust accounts that are available, particularly to those who come from fewer resources, to engage with wealth-building activities like homeownership and entrepreneurship. And it may have helped, and the third part of my answer is this, that the distinction between income and wealth, I think, matters. Most of public policy, we focus on helping people get by. And we have to do that, and we have to do better at that. And income, if we think of that as a flow of resources to be able to afford our lives, is essential. We want quality jobs, living wage, all the things. Wealth, on the other hand, is helping folks thrive. It helps folks have stock of reserves that they can use for a rainy day, to weather economic shocks or pandemics, to have the means to put a down payment on a home. So baby bonds sits in that domain. So more than getting by, but getting ahead is what baby bonds attempts to address.
That's great. Thank you. And as I turn it over to Treasurer Montoya, I want to give a shout out to Councilwoman Felicia Porter, who just walked in from Baltimore City. Thank you for being here. So Treasurer Montoya, here, that's for you. Tell us about the potential you see in baby bonds and why you're championing the policy in New Mexico.
Well, thank you very much. Thank you for the warm welcome. Thank you, Treasurer, as well. Es un gran placer que estoy aquí con todos ustedes. I am very passionate about baby bonds, and the reason for that is you have to know a person's story to know where they're coming from, to know where they want to go. And growing up, working 3 jobs to go to school, to make ends meet, to get my bachelor's degree and my master's degree, no matter how much more I worked, it wasn't going to change the outcomes of the pay salary that my parents were making, which both have been very good at serving their community in their own capacity. So I want to be clear, I don't think for me this is about a handout. I think this is about an investment, and that investment has returns, and those returns include access to wealth, bridging the wealth divide, improving health outcomes, and strengthening our economy. For me, it's a win-win and it's a no-brainer. So New Mexico, you'll see some of the data up there. I sort of hate talking about it because the beauty of New Mexico is that we're very cultured. We're a majority minority state. We have the best chili and the best jewelry. There's a lot of positives. Economically, we're the second largest sovereign wealth fund in the country, anticipated to be number one. We have about $58 billion. When I tell you all of that, along with the largest wind turbine that's going to create energy for Arizona and California, and we're doing a lot with our national labs, all of that doesn't connect to the numbers and the data that you're seeing on your screen. We have a substance abuse problem. We have the highest crime in the city of Albuquerque in the nation. We're number 14th in the world. Suicide, we have a lot of deaths. We incarcerate people more than any other state. Child well-being is last. Education is last. On the other end of it, you may have seen the national news that we just allowed for free education a few years ago and now free daycare for children. This is the next step to all of that. And that's why I support it very strongly, and we're trying to push this in our own state because we have the money, we have the need, and I can see the vision of something that's way better for our state than where we're at today.
That's great. And can you talk, just to follow up on that, the kind of impact you think baby bonds would have in New Mexico? I know you've done some work analyzing specific case studies of individuals over their lifetime. Do you want to share some of those examples? I think we have some of that on our slides even.
Yes. So we did something very similar to what I just saw that you all had done. We looked at first at $1,000, $3,000, and $5,000 because I think sometimes when you've grown up in poverty, you always have this tendency to barely get what you can get instead of thinking bigger. So I'm working on that. So I went all the way up to the 7,000. And it also made sense because in 20 years, what is that $1,000 going to look like versus the 7,000? And so go big or go home. So the $7,000 investment in every child born in New Mexico, there's about 23,000 children born in the state. We have a problem with people wanting to have kids because, as you know, we can't afford kids, let alone afford housing. So we also have another problem with outmigration. So at the age of 25, it's about $23,000 to $37,000. By the time they're 35, it's between $74,000, and it can go all the way up to almost $600,000 by the time they're 65. What I would envision and hope that our legislature will commit to is not only entrepreneurship, which we would partner with our Small Business Investment Corp, and not only our housing as a down payment, partnering with our Housing New Mexico division that can help with that, but also we recognized that there was issues with car dealership, needing a car. We're in a rural area. We don't have the trains. We do have the planes, but it's only in 2 spots. And so a lot of people need the transportation to be able to go to school or to a trade, which is the other 2 items that we're hoping that would be funded. Because we don't charge for college tuition, a lot more of that money would be used towards the transportation to be able to go to and from, and then the business entrepreneurship.
Right. That makes sense. That's really interesting. And before we move away from the policy discussion, something that's been in the news recently and that I'm sure will be in more headlines soon are the Trump accounts. In fact, I think I just saw a headline this week about the Dells funding, out of Texas funding Trump accounts. So David, could you talk? The Trump accounts are not baby bonds. It is quite different. Could you talk a little bit about what Trump accounts are and the difference between Trump accounts and baby bonds? And for those who don't know, Trump accounts were created in H.R. 1 that passed this past summer.
Yeah, so the headline is right. So baby bonds are not Trump accounts. Trump accounts are tax advantage savings accounts, really, that really will benefit those who already have resources. The potential value of Trump accounts come in the ability for a family to have savings to contribute to them. So, for example, there is $1,000 seed funding from the public sector, from the government. You know, with a 5% interest earning, that would grow to about $2,500 over 18 years. A young person can use it for a set of activities. For those who have the ability to max out the annual contribution, $5,000 a year, that same $1,000 seed funding with the annual additional contributions would be well over $150,000. So the benefit will accrue to those who already have the means and resources. And the emphasis on savings is a distinction with baby bonds. The power of baby bonds is not one savings behavior, which certainly we want to encourage and incentivize, but it's actually the endowment itself, like having the substantial seed capital the young people can pursue wealth-building activities with.
I will add to that because he's very politically correct. These are two totally different things. You have to decide what your purpose is. If your purpose is to help the gap on the wealth to go and expand, go get a mega account. If you want to make sure that people who already have really good businesses to get tax write-offs because it allows for family and employer contributions to be matched, poor people don't necessarily have an employer that can match that amount of money. So you're widening that gap. So you really have to understand, especially as lawmakers and as people who are collaborating, what's your purpose? If you're trying to help strengthen your community, your families, build your economy, allow for people to stay in their own communities and work here, then you don't want a mega account. You want a baby bond that is structured exactly to build your economy and your people.
Thank you. So let's move on. Policy is so important, but so is implementation, right? And you don't become treasurer or comptroller if you don't care about, getting the implementation and the actual construction of a program. I like to say, we want to do the right thing, but we also want to do the thing right. So talking about implementation a little bit, Treasurer Montoya, why don't we start with you? In New Mexico, you have been talking about eligibility, investment accounts, eligible uses, time horizons, how to pay and administer the program. Talk to us a little bit about the program as you envision it.
Sure. So there were two bills that came out this last legislative session from a collaboration of efforts that had happened prior to. And so I think it's really important, these types of conversations you're creating before the legislative session, to know how much are you willing to move forward quickly. Are you just wanting a task force? Are you just wanting the feasibility study? If you've gone past that portion, how are you going to collaborate different agencies? For me, as a foster mom, having foster children, being able to have their Social Security attached was an important aspect of this, that the money always goes to the child, not to whoever they're with. Because in New Mexico, a lot of grandparents help take care of children as well. So it's trying to think of all the unintended consequences that occur in the process. Looking at pilot projects that have happened. In New Mexico, we have one with Partnership for Community Action, and we did another one with Northern College, so they can help test out some of the things you don't think about when you're trying to get something like this done. Working with the people who, in your state, I don't know if it's vital statistics here, but who's taking care of the data of every child being born. And of course, this is mostly for Medicaid recipients, but you never know if a child through that course of time is going to end up being in that dilemma throughout that 18 years. So you want to know that you can still get that data if it's necessary, for example, if they ended up in foster care. So all of those aspects, working with different agencies and collaborating and getting the buy-in, I think is the critical aspect of making sure it's in the legislation so that even if they don't have the buy-in, they know that they're going to have to be a part of the conversation to get this completed.
David, you were instrumental in getting this passed in Connecticut. I know you worked closely with Treasurer Wood in there, and now Treasurer Russell, who wanted to be here but couldn't, has been working to follow up and implement the program. Could you talk to us a little bit about Connecticut's model and how they've been implementing it?
Yeah, happy to. And I'll also say a little bit about the journey, how do you get from the idea to actually winning the policy? And this is a thing that's actually happening in a place that's benefiting real babies. So this is more than an academic paper, which it was. It's more than an inspiration, which it is. But it's an actual thing that is serving now more than 30,000 babies in Connecticut who are automatically enrolled. There's nothing that they or their families have to do. And they are eligible but because they were born and their birth was covered by Medicaid. That's it. And in Connecticut, where I come from, a state of 3.5 million people, one of the wealthiest states per capita in the country, 1 out of every 2 babies in our state are born into poverty under Medicaid. So even in a state like ours, our state treasurer, elected leaders, stakeholders, including mayors, faith community, labor, banks and financial sector, credit unions, hospitals, healthcare, this really diverse army of people recognize that we cannot program our way out of poverty, that the issues are structural, and that if we don't address these structural issues with better policy, then we'll forever be on this treadmill of trying to help people just get by rather than get ahead, as mentioned before. So it's with that sort of really elegant framing, recognition that baby bond eligible babies are in every single one of Connecticut's towns and cities. It's just not a big city thing, but it's also in the country, the suburb, and everything in between. So that helped in terms of legislative engagement because folks saw themselves and their constituency in this opportunity of baby bonds. And that combination of stakeholder engagement, of strong messaging, and how something like baby bonds is a great complement to the really important investment in people today. As powerful as baby bonds is, it doesn't put food on the table, but we have to put food on the table. So it's not an either or, it's all the things together, affordable childcare, housing, all the things. And I think that sort of melding together of the different people-focused investments was really compelling for Connecticut stakeholders and has led, I think, to the interest and momentum around the country, and we can talk more about that later on, but that's a short Connecticut story.
Great. So I'm going to have two more questions, one for each, and then open it up to audience members. So feel free to think about what your question might be if you have one. Some of your advice. Give us some advice here in Maryland on the challenges that you've had in New Mexico or the questions that you've answered from legislators who are skeptics who hopefully now believe in this program. What are some of the things that we should make sure that folks who believe in this and who want to push it and promote it in the state legislature, what are some of the things they should be talking to their fellow legislators about?
I think what I've heard some of the pushback on is what we need now versus what we need tomorrow. And in my mind, it's why can't you have both? You need to be able to prepare for the future. When you have different seasons, you don't not prepare to get your jacket in the winter when it's freezing cold outside. You have to prepare and plan accordingly. I think the other part of it is people are always thinking that this is a handout when the reality is it's an investment. And we make investment decisions constantly through our course of time. This type of investment, and I think you guys have something in your packet that will show you $242 million in new household wealth for home equity, $150 million in business revenue and entrepreneurial activity, $130 million in new tax revenues. All of those are positives. So at the bottom line of it all, in my state, the 23,000 children born, $7,000 investment turns out to be less than $700 million. You know how much we spend in social services every year? Take a wild guess, and I'll tell you that it's $2 billion that the state gives and $8 billion that we get from federal funding. So I know a lot of you aren't from the ranch, but you can either give me fish or you can teach me how to fish. And so is it that we want people to have to continue to get, to me, that's more of a handout than the idea of teaching people how to fish. If you were born poor and you have a teacher that tells you, you're gonna have $25,000 by the time you're 18, what are you gonna do with it? No matter how you were born into this world, no matter what your life circumstances were, how are you gonna be born into that? And how are you gonna focus on what you have? When you have a plan, when you get told you have opportunity to have that plan, you think differently, you act differently, you respond differently. Instead of being in a trauma, position, you're thinking, oh, I am going to be able to go to college. I can potentially go to a trade school. I can own my own business because my uncle taught me how to do electricity or someone taught me plumbing. It's a whole different mindset that you're bringing into your community. And if you have out-migration the way we do, why would you not want to keep your children with their families in their rural communities or in the places that they grew up and that they love? Because then you get to foster more when it comes to business. Then you're adding in gross receipts tax. You're adding in property taxes, which then helps fix your roads and your hospitals. The second big argument that I hear from legislators is, and they don't say it this way, but I'm going to say it this way. How's this going to help me now to get elected next year or in 2 years or in 4 years? I need to get money to my constituents today. We can keep thinking that way, but the reality is that you have to envision what is it that you want to leave behind. I just went to your state capitol and I saw some amazing public servants that served this country in the military and then became governors and delegates and the House and the Senate. How do you want to leave your state or your district? Do you want them to talk about you more when you're long gone, that you did something that was envisioning a better future for your communities and your districts? Or are you really just trying to get reelected? And if that's the case, then what's the point? The whole idea of public service is to be the visionary, to think ahead and to invest and to promote your communities. And this is the perfect way. To me, we mitigate risk all the time. This has nothing to do with not having the risk calculated in.
Thank you. And David, to conclude before we turn it over, talk to us nationally. What are you seeing across the country in other states and models and programs?
Yeah, I mean, it's really, since Connecticut passed and funded the first baby bond in America, there are now 20 states that have either introduced or seriously considering baby bond legislation. There are 10 baby bond pilot projects that have popped up, including one here in Maryland, that are operating in red, blue, and purple states. And there is continued interest in momentum around building an infrastructure to support leaders from these different states and in new states that are beginning to engage with this opportunity. So a lot of the work ahead is to continue to socialize the idea, to talk about the role that wealth plays, and not just economic prosperity for individuals, but for a locality's economy, and that's all powerful. And two more quick things I'll say, just to follow Treasurer Montoya's points, are that, imagine if we had done baby bonds in Connecticut 20 or 30 years ago, or if Maryland had done it 20 or 30 years ago. Imagine the position those young people would be today to better weather the economic calamity we're in, the self-inflicted economic calamity that we're in currently, to get through pandemics, to get through recessions and economic shocks. Well, we didn't do it 20 or 30 years ago. So what the next best day to plant the tree is today. And yes, it is an investment, but we're spending those dollars already on more costly, less effective interventions for our young people. So why not get in front of that and interrupt these inherited cycles of poverty that otherwise will go on indefinitely?
Very well said. Questions? Raise your hands. Yes, back in sorry, go for it. And can you just introduce yourself and then let us know your question? Thanks.
Hi, I'm Janine. I'm with Elevate Baltimore. And thank you all for sharing. Treasurer Montoya, as you were sharing about youth that are in foster care, I also think about some of the guardrails that could be in place for various communities, particularly folks of color. And I think about the high instances of when people are incarcerated, and will people still be able to have access to those funds if they are, whether justly incarcerated and or not, and if there's some type of inheritance where it can be transferred over. And so I will be very transparent. I'm thinking about this because I want to make sure that there's not a way to kind of commodify people, especially when I read this and it says that it's indirect access to funds. Yeah. So I just wanted to see if you could share a little bit about that.
Sure. I'm glad you mentioned that, because there's two big parts that I didn't mention. One is that there's guardrails in the sense that all of us were 18 and we know what we did, and if we had $20,000, what we would have done with it. And so in doing so, to be responsible, the idea is that if you go to a university or a trade school, the invoice gets sent to the state, whatever agency you all decide, and then they pay the university. So it's not going directly to the individual, it goes directly to whoever is owed that amount of money. If it's a business proposal, we've been thinking about using our SBIC, Small Business Investment Corp, so they can look at the plan and the proposal, help guide them through that process, get them to that point. The second part is a financial literacy component. So you can't touch this money until you actually know how it works and how it operates. It's just like anything else that is a weapon for you to use, good or bad. You have to know how it works and functions before you can use it. And so we're trying to add that financial literacy component. For incarceration, it's for the child who is born, and it depends on your legislature. So if that person already fulfilled their obligation, they're back out and they are wanting to use it towards that entrepreneurship, small business, or the car, whatever the legislature decides, like that's all for all of you in this room to help create and develop. And every state is going to be very different on that end. But I think that's the important part and the difference between a mega account and a baby bond is, who do you want it to purpose, and what purpose is it going to be used for? And that's one of the bigger differences is that the whole goal is to bridge the wealth divide. It's to allow for opportunity. And I'll just say this one last thing. I get frustrated when people try to say, well, they should fend for themselves. I will tell you, I was on Section 8. I've been in the projects. I lived on Section 8. I lived in a trailer. I've lived everywhere. And I have a good family. My parents have been married for 40 years. I worked 3 jobs while I went to college. Like, no one can work harder than me. It wasn't the problem that I didn't know how to work. It was the problem that it was like a hamster and I was going in circles to get out of that predicament. For somebody as a child to be able to say, I have $25,000, what am I going to do with it? And I have 18 years to think about it. That shifts mindset. That helps shift economy at the end of the day.
Is there anything you'd like to add?
I would just say, to Treasurer Montoya's point, you get to decide. Make it work for Marylanders. And the Connecticut design is such that the only eligibility requirement is that your birth is covered by Medicaid and that you're a Connecticut resident at the time you make your claim. So if along the way you're involved with the justice system, you can also come and go out of the state, but at the time you make your claim, that the dollars deploy to you. So you get to figure out really what makes the most sense for the folks that you want to most serve.
And the money is here. So
Right.
you buy
Stays
your
here.
house here.
Here.
You can
Yeah.
go to college somewhere else if the legislature allows it, but you have to use the money here for your small business or so you're building your own economy.
Yep. Yes, Delegate Ziegler.
I'm Natalie Ziegler. Can you say something about how and by whom? Oh, sorry. This is cool. Sorry. Too cool for me. How and by whom the money is invested and what assumptions you're making about the growth of the money?
So the seed amount that funds the Baby Bond Trust, it's $390 million initial startup funding invested and managed by the State Treasurer's Office.
In Connecticut.
In Connecticut, right. And again, there might be different formats or designs in other places. And those dollars are invested in ways similar to the state employee retirement account, sort of mixed asset class. There's an assumed rate of return of about 6.9%, a little nerdy. But that's how you get from the seed amount, $3,200 per eligible young person, with the investment growth to get it to the $10,000 to $20,000 when the young person comes of age. So it's, again, managed by treasurer, mixed asset class, the 6.9% investment return.
And we have a 6.8% return in the pension system, and so that's what we used in our report to keep it similar and realistic.
On ours, we used a 7% annual rate of return, slow declining birth rate, negative 0.6%, static mortality rates and static immigration rates, immigration beneficiaries claimed at steady rate of 18 to 35 and 100% claim rate. So that was the data for New Mexico.
One thing I'll say too about real quick, so that $390 initial $1 million 2 years ago, the first 2 years of returns have been really good. So it's worth over $450 million now, which is this point that this is initial startup funding, one-time funding from the state. You allow the investment earnings to do the work, and you magnify that initial state investment to leverage those additional returns for economic growth power.
Mr. Treasurer.
I'm just curious, how does it? Thank you. How would the program work with the so-called One Big Beautiful Bill? If I'm not mistaken, I'm sorry?
The Trump accounts.
Yes. How would that work for the existing programs that you have? Would they work in tandem? Would that, I don't know, how would that work? Would they work together? Would someone be able to benefit from the federal and the state programs? How would that work?
So to be determined, and there's still a lot to know and learn about how the Trump accounts will roll out. The advice that we provide is that they can be a complement, but as Treasurer Montoya mentioned, they solve 2 different problems and approach it in 2 very different ways. Again, the Trump accounts rely on savings behavior and savings means to make them useful. And the baby bonds, at least in the Connecticut design, focus on the endowment and the trust itself. And there are also eligibility requirements that constrain those who will actually be available for Trump accounts. You have to file taxes. You have to have a Social Security number. So that excludes some of the folks that, at least in the Connecticut design, we attempt to support and serve. states will have to think about what alignment there might be, but our thinking at this point is that separate infrastructure makes the most sense for now.
That's interesting. And one thing to know, as David mentioned about the Trump accounts, which we haven't seen the regs for yet, but is that the Trump accounts, as he said, are for tax people who are filing tax returns. And of course, we have a huge number of low-income families in Maryland who don't have to file a tax return. And so there's this big swath of people who will be completely left out of the Trump accounts, which I think, is obviously problematic for many reasons. But other questions? Yes, Robin.
I'll just be really loud. No, it's fine.
It's live streamed.
All right, I'll be super loud. So I'm Robin McKinney with the Cash Campaign. Thank you for your leadership, all of y'all's. My question is, because this came up when we ran the Guaranteed Income Pilot in Baltimore City, and we were first announcing that eligibility was what really came down to deserving and undeserving poor. And that's what everyone's pushing back about, like, why Medicaid versus this, versus that, versus this group. And I just wanted to see if you could share a little bit about what your experience has been pushing back on that, about like whatever population we pick. And then I also just have to be on the record to say, like, we believe in giving cash directly to people. So I know the legislature, and there'll be lots to debate, but like, we trust people. We saw in the Guaranteed Income Pilot that people spent the money in all the ways that they do to support their families. So just have to say that.
I don't trust people. I trust but verify. And as a public servant, I have to make sure and be accountable for the $700 million that we put in. And so that's where I stand on that end of it. Accountability is critical, and different people have different life circumstances. A lot of them are moved around a lot. And so it's not necessarily just the child I don't trust. I don't trust sometimes the people that are with them. But I come from a different life. I grew up differently. And so I think that's important. I think you have something to say on the second part of that.
Yeah, I mean, the design feature in Connecticut shows it was intentional to have the resources go to a third party, not necessarily for lack of trust on how the individual will put them to work, but to do two things. One is to protect against predation and extraction. You can imagine if that young person receives a substantial sum of money, probably not accustomed to having managed that sum before, there could be bad actors, and not just family members, but others who try to take their share of that. And also the systems, who have some history of doing a little bit of that. And the other thing we think that design also helps address is the concern that the distribution might be taxed or might be counted as an asset, or it might, knock away some other public benefit that the family might otherwise be eligible for. So that design is intentional in that regard. And the point on deservedness is right on. I think it's one of the appeals of baby bonds, because babies are cool, right? Who doesn't love babies? But it's also this notion that babies didn't choose to be born into this family or into that zip code. We can't have babies work harder. Babies are just babies doing baby things, and that don't we want them all to be set up so that they can live the best lives that they can?
Can I show you a positive on one of those data points? Some of you are visual people, and so these two little graphs will show you when they actually used money. This was scenarios from Echo Northwest that we did. And so for this one, they went to nursing school for $13,000. The money on the top is how much money that bond made off that $7,000, and then the deductions are what they used some of it for. Even with nursing school and a down payment on a house, based on the numbers at the time, which was at the beginning of this year, they still had a return of $158,000 for retirement. If you look at the second one, which is cool on the small business, this was an individual in Socorro who they only had $23,000 or $26,000 per year for him, his mom, and his grandma. And he ended up going to a plumbing school or some type of electric school thing with a car purchase of $8,000. That truck helped him to put all his stuff in it and go to a different business and then get the business licensing and open the business. And he still had $107,000 for retirement. Because remember, well, in New Mexico, small businesses don't necessarily have insurance. And so they added all of that in there and they still had a lump sum. So for me, these are positives. These are real scenarios based off of the data and the research at the time. And that last graph that you'll see is all the positives. What can baby bonds decrease? Substance abuse, violence, outmigration, suicide, incarceration, using all your state income money for supplemental, and instead education, health, child well-being, and your economy. The whole point is that you're going to build your economy in your community.
Right, because this is money that's coming back to Maryland and going into the people who are living in Maryland. And so really important point. So I think we'll end it there. A huge thank you, David, for all of your work around the country on this, for you and your colleagues helping us, being great consultants and team members, and as we work through this report. Treasurer Montoya, thank you so much for your leadership in New Mexico and across the country on baby bonds. Thanks, everybody, for being here, and we'll bring up the next panel shortly. Thank you.
We're going to take a 2-minute break as we set the stage. I know folks will trickle back in, but I'll just do a brief little setup here. First, just thank you, Treasurer Montoya, David. That was awesome. That was really helpful. I think if we needed to convert anyone to baby bonds, that certainly did the trick. So we're going to shift gears a little bit now and talk to some folks who are working on the ground here in Maryland. David mentioned that There are a number of baby bonds pilots across the country. One of those is in Maryland. We'll hear about that in a minute or two. And then there's some other work that's happening. So we've got a great panel here to talk through some of these local activities. And before launching into it, I'm just going to let our panel introduce themselves. So Darius, starting with you, why don't we just go down, just give us your name, your organization, and just very briefly kind of your connection with baby bonds.
Certainly. Well, good afternoon, everyone. I'm Darius Graham with the Greater Washington Community Foundation. We serve Northern Virginia, Washington, D.C., and Prince George's County and Montgomery County in Maryland. We focus on closing the region's racial wealth gap and fostering economic mobility. We have a strategic vision of doing that over 10 years, and one of the ways that we're doing it is through guaranteed income. We're also supporting small businesses, and also we have a baby bonds program or child savings account program called Brilliant Futures, which I'll share much more about.
Good afternoon, everyone. I'm Tanea Moore, Director of Policy with the Cash Campaign of Maryland. CASH stands for Creating Assets, Savings, and Hope, and we promote the economic advancement of low to moderate income people across the state of Maryland. We do that through a variety of services, including free tax preparation, financial counseling, advocacy, and more. One of the ways that we're closely connected with this topic today is through our work with guaranteed income, baby bonds, strengthening the social net, and also advocating for the expansion of tax credits.
Hi, everyone. It's wonderful to be here. Thanks for having me, and it's great to see this room so packed today. My name is Madeline Brown. I'm a Senior Policy Associate at the Urban Institute, where I lead our work on early wealth building. So that includes research and policy translation. We have run a community of practice on early wealth building for some years now, and I was tied in closely with the DC Baby Bonds program. Plenty to talk about there if folks are interested, but have been tracking and supporting policies across the country, including here in Maryland.
Great, thank you guys. Yes, we'll talk about DC, but let's talk about Maryland first. So Darius, why don't we start with you? So you mentioned Brilliant Futures, which is the pilot program that your foundation has been supporting. So give us a little background on it, how it came to be, what the goals are, how it's operating, where it's operating, and kind of the 101 on the program.
Certainly. So coming out of the pandemic, our CEO, Tonya Wellens, and the board of the foundation created a 10-year strategic vision, again, focused on closing the region's racial wealth gap and fostering economic mobility. There were many ways that we're doing that, again, guaranteed income programs, small business supports, but also through a program called Brilliant Futures. And the way that it works, it's very similar to a baby bonds program, but we start in kindergarten. So we partnered with 2 schools, one in Prince George's County, one in Montgomery County, and we have enrolled kindergartners up to 100 students per class, so that's up to about 400 students in total. They are getting a $1,000 deposit in kindergarten, and each year that then they can redeem when they graduate from high school. So if they stay in that school or in that district for their entirety of their education career through 12th grade, they'll have $13,000 that they can redeem at graduation. They will also have likely much more than that because of the investment returns, which you all have heard about today. A couple of things that I'll say that are really important about how we have designed this program. We're working in close partnership with the schools, the communities, and the families. So in each community, we have a community engagement partner that's doing things like family fun nights for the families of the students that are enrolled to make sure that we're building community around these students. And also we're providing financial coaching services for these families as well. One new thing that we're going to be launching is, you heard earlier about the need for, do we invest in the future? Do we invest now? We're taking the approach of doing a little bit of both. So while these students know that they have the promise of $13,000 or maybe even possibly $25,000 when they graduate, we also have something new that we'll be launching called an opportunity fund, where if a family member needs support to buy a car or to get a certification or help with the medical bill, we will have some limited funds available that families can use just to help them right now in this moment before they can tap into those dollars. So we're really excited about this program. We have a couple hundred kids signed up already, classes of 2036, 37, 38, and we're really excited both for them and for their futures.
Thanks. Just a quick follow-up. The full funding comes from the foundation exclusively, correct?
Certainly. So this is privately funded. This was part of a larger capital campaign that the foundation undertook, and we have just so many funders that we're grateful for, other private foundations, individuals who have contributed to this possible.
Great. And I know we've got some Prince George's and Montgomery County folks in the room. What are the two schools that you guys are?
Bradbury Heights and Jackson Road. I also just want to give a quick shout out to Mandy Koba, who's in the audience. Mandy is our program officer and manages these programs day to day. So we can both share much more about sort of the ins and outs of how these go. But thanks, Mandy.
Great. Thank you. Thanks, Darius. Tanea, let's jump over to you. So the cash campaign has been in and around the baby bond space for a couple years now. I know that you guys have kind of evolving and kind of building out the work. Why don't you share with us just a little bit about the timeline that you all have been working on and kind of where things stand in your guys' view?
Absolutely, absolutely. So as Ben said, Cash Campaign has been at the table with partners like the New School and Prosperity Now, the Comptroller's Office, and others for quite some time now. I'll take us back to 2021. The Cash Campaign staffs the Financial Education and Capability Commission, which is a legislative commission tasked with the responsibility of exploring options and ways that we can expand financial opportunities in Maryland. So in 2021, the commission decided to create a work group to study key elements of a baby bonds program in Maryland. There was actually legislation that was introduced but did not move forward because we still needed to figure out some of those key elements, a lot of the questions and conversations that we continue to have today. We also collaborated with national partners to push for federal advocacy, supporting Senator Booker and Rep. Presley's bill around baby bonds, and really wanted to build on the momentum and just the push for why baby bonds is important, not just here in Maryland, but across the country. We also continue to support local pilots, such as in Montgomery County in 2024, a council member Jawando's baby bonds legislation we were able to stand behind and support as well, and continue to have conversations, whether at a local level in Baltimore City, but also across the state, again, advocating for baby bonds. Earlier, I mentioned our work around guaranteed income, but Cash Campaign was the nonprofit administrator for Baltimore's guaranteed income pilot, the Baltimore Young Family Success Fund, where 200 young families received $1,000 a month over the course of 24 months. So our work through guaranteed income shapes our continued work around baby bonds, because for the Cash Campaign, we look at it from a lens of how the multiple wealth building tools and tools that helps around economic mobility can actually work together and not be against each other. So we can still have conversations and push guaranteed income while also pushing on baby bonds and strengthening the social safety net and pushing for tax credit. So that's something that's very important to the Cash Campaign, and those are conversations that we continue to have today. Most recently, we hosted a webinar where we partnered with the Comptroller's Office and David from the New School to talk about ways that guaranteed income and baby bonds can work together, and discussing some of the learnings that we found from Baltimore's guaranteed income pilot, but also hearing from a participant about not only her experience in Baltimore's guaranteed income pilot, but what baby bonds would mean for a family like hers. So that was a really interesting conversation. I'm happy to share the recording if that's something that anyone wants to go back and look at. But for the Cash Campaign, now that Baltimore's guaranteed income pilot is over, we will continue our conversations not only around guaranteed income, but around baby bonds as well, because we know that it takes multiple tools in order to close the racial wealth gap in Maryland and continue to drive families down the pathway towards economic mobility.
Great, thank you for that. And thanks for also mentioning the federal legislation sponsored by Senator Booker and Congresswoman Presley. I believe on our live stream, a staffer from Congresswoman Presley's office is on. So we are talking national here, as well as a lot of people from New Mexico. So Madeline, let's turn to you. Now, you've got a national lens on this as well. I know that you were involved in the development of the DC program, but maybe talk a little bit about how you view some of these pilots, some of the work going on in Maryland, and from your perspective, what are some of the key features that maybe we didn't hear about on the first panel that you'd really emphasize as it relates to baby bonds programs?
Sure, thanks so much. So I think we talked a lot in the first panel. We saw that great slide. from the new school and from the report about sort of the pilots. And I think one of the important things is also to recognize that early wealth building programs in general really have existed since the 90s, and that a lot of them really share sort of these core principles, and that some of the design differences have huge implications for sort of who benefits and at what level. And so I think because of that, there's this sort of rich body of research and practice that we can learn from. So I think some of the important things in terms of design features that maybe I'll just add some sort of a little bit of background on. This question of sort of who is your target population and do you have a universal program or not, right? Universality is an efficient way to build a program. It's important, though, that it's matched with progressivity, right? And I think at the state level, this becomes really important. A lot of the pilots, I think, rightfully choose target populations because you have to think about what your scale is, right? You don't have unlimited resources. You have to manage not just the money, but also the outreach to these families. You have to make sure that you actually have the funds for them when they turn 18. And so you have to think about who is your target population. At the state level, or really any government, you also have to think about how you build in efficiencies of communication, of financial education, and how you make it work with other programs that exist, because we know that there is no one single program that's going to support income and wealth or any of the needs that our families have. So in general, sort of at the research principle level, universality plus progressivity is really important, and there's a couple reasons for that. One is the sustainability of a program is improved if everybody has access, right? So if you can build a financial education program around a policy that everybody in a kindergarten class, everybody in a high school class has, all of a sudden, if you have state-funded or state-mandated financial education, you can actually build it around this program because everybody has access to the account. Now, that isn't to say that we don't want to support lower income, lower wealth families and understand that their resources are more constrained. And so that is why the progressivity becomes really important. So at the federal policy that we've talked about suggested that we start everybody with $1,000 and that every year after that, based on a family's income, we add progressive deposits such that the lowest income families will ultimately receive the highest amount of government subsidy, government investment. We modeled that policy to sort of try to gut check that, right? Like if we actually do something like that where we do give everybody $1,000, even the wealthiest kids, does that not further inequity? And what we found actually is that if you build progressivity like that, lowest income families, and in particular, Black and Latino families, end up with the largest sums. So I think it's important to both think about what is the goal here, and as a state, how do we think about spending resources in a way that's efficient and that lets us sort of work with other state programs that we have. So that's one thing I'll mention. The other thing is just the sum, right? I think we talk a lot in the field about like, what is the magic number, right? Everybody wants to know like, how much money should I put in a baby bond? What should the guaranteed income sum be? And I think in the baby bonds world, in the early wealth building world, what we say to jurisdictions is, what do you want people to do with that money, right? If you want them to buy a home, go look at the median down payment on a home in your area. If you want them to go to school, go look at what living and going to school for a year at your public universities costs. We heard the treasurer talk about how higher education is free in New Mexico, and therefore we know those living expenses are going to be the main thing that students need, textbooks, computers, things like that, and so you can do the math. And so I think these are important things to mention because as we talk about sort of program design, one of the things I think that's great in Maryland is this report on its own, right? That the sort of thinking through what is the sum, who are the enrolling agencies, like all of that work is not easy, and I commend you all for it, because I think what we see often is like one state gets it done and then everybody uses the same sort of like rough design, and the reality is these things really need to be designed to work for your state, to work for your residents, and so I think in terms of the sum, thinking about understanding that money is going to grow over time, and so you do want to front load that as much as you can, right? But also recognizing that you might as a state have things that you want these people, these kids to spend this money on. And so it's helpful to work backwards and sort of say, okay, rather than just pick a random number and see how far we can get in 18 years, let's see if we can think about what are the things we actually want people to do with this money and work backwards from there.
Great, thank you. And that's a great segue to the next topic. And let's kind of dig in a little bit to some of the modeling for Maryland. So, Madeline referenced, some of the different scenarios or approaches in the report, The way we did the modeling is that we looked at 3 different eligibility criteria. So we did one that was the universal access, and in Maryland, it's about 65,000 babies born per year. We did our second one, which was the Medicaid coverage, similar to Connecticut, similar to what other states are looking at, which is about 30,000 babies in Maryland per year. And then we did a third one, which was more targeted, and that was the 110 census tracts covered by the place-based initiative at the state level called the Enough Initiative. And in those 110 census tracts, it's about 5,500 babies born per year. So kind of at those different levels, you can have very different investment levels and very different outcomes in terms of earnings growth. So maybe Darius, I'll start with you. What would be your advice, or kind of what's your view on how to approach this in terms of, casting a wide net, with fewer resources invested, or maybe a more narrow net with more resources invested?
Yeah, I think the targeting is where the real impact can be. And I think it's part of what Madeline was saying is like, what do you want the individuals to do with the dollars? And I think if you're looking at a down payment or education, the cost of a car, those sorts of things, sort of the more that can be seeded into the account for the individual, the farther that goes. I think particularly one of the compelling pieces about the Enough Act alignment is because you're already building in this alignment with other resources in the community, opportunities for the families, and so on. And one of the things, like I said, with Brilliant Futures that we see is so important to the success of our program is those community partnerships and making sure that it's not, the promise of the money in about 13 years is hugely valuable and hugely important. But also important is the community support, the navigation, the referrals, the other resources that we can provide to families while they're waiting on that investment to come in 2036, 37, or 38. So I would focus on one of those 2 targeted, the Medicaid births or the Enough Act, and think about some of the higher dollar investment amounts, particularly the $7,000. Because I think to Madeline's point, that really gets you to the point where you're moving the needle on things like home ownership. You're really allowing people to make these big investments for their future, but also for the state's economy as well.
Great, thank you. And as you know, the modeling that we did in the report, one of the scenarios was looking at a $7,000 investment amount similar to New Mexico per baby. And where that gets you in 18 years at a 6.8% return is at about $25,000. After 30 years, it's about $50,000. And that is a substantial amount of money to make a real impact. So Tanea, let's jump to you. Obviously, Cash Campaign is very well known as being in the financial education space. We've been talking a lot about how, the program can't just stand on its own, and that we do want to combine it with other resources and services. So maybe talk for a little bit about, how you would see a program structured where financial education is really built in from the beginning.
Absolutely. There are different pathways that Maryland can take, but of course, for us, the main priority is impact. So as Madeline mentioned earlier, we want to make sure that that amount when a person turns 18 or 30 is in alignment with the actual cost it takes to put a down payment on a home, to go to afford secondary education, to start a business, or whatever the allowable uses will be. We would like to see this working hand in hand with financial education. We want to make sure that people have the tools and the resources in place so that when they do use their money, they know the tools, they know what it requires to go ahead and be able to purchase a home and all of the other things. And it will also build upon the existing exposure of financial education that's already built within Maryland's school system.
Great. And Darius, as part of the Brilliant Futures pilot, you guys have a financial education piece built in with the schools? Can you talk
We
a little bit
do,
about
yeah.
that?
So it's one of the kind of community-based partnerships that we have. So we're working with a provider called Trust Plus, which is a financial coaching program, also with LEDC to do some in-person workshops as well. But the idea is that this is something that people can take advantage of and use now, not only to understand how they can use the money in the future, but to also set and achieve goals currently. With the Latino Economic Development Corporation as one of our fiscal coaching sponsors for now, it's even another resource for the families because not only can they help you think about goals and achieve those, but if you are looking for a business loan or some other kind of assistance, they have resources they can help match you with today. So it's just another way that we're providing resources to people.
Great, thanks. Madeline, let's jump to you. So wanted to talk a little bit about kind of the administrative structure and maybe what your advice would be or what you've seen in some other states across the country. What we find in the report is that in most cases, These programs are operated by one of the state's financial officers, right? So that's typically a treasurer's office, could be a comptroller's office. So obviously other agencies need to be involved, especially if there's eligibility determination, if there's financial education. Obviously any agency doing this needs to have the capacity to do fund management, to do claims processing, distribution to the third parties. Maybe just talk a little bit about, what you've seen in other places and like what type of advice you would have for Maryland.
Yeah, I appreciate it. And just one note on financial education, because I think it's important. This comes up as sort of like, is it a little bit like paternalistic, right? To say, we're going to give you financial education, we're going to make you do a course before you get this baby bond. We do focus groups with young adults on these topics, and the number one thing that they always say is like, please give us financial advising if you're going to give us this amount of money. And so they're very clear about it's financial advising, right? Like this is wealth that we are being given, and we want to be advised on our best return on investment. Like they use this language. It is not like how do you budget $500 in income, right? But I just think it's an important point that this is what we're hearing from young adults as we're talking about baby bonds too. But as part of sort of the state agencies and the administration, I think it's important to sort of break down the roles, and I think the report does this really well. People think about a baby bonds program and they often go first to like, okay, well, who's managing the money, right? And that's necessary and important, but there are so many other pieces too. And this is where I think the earlier that folks can work across agencies and sort of like socialize these programs, the better, because A, you find efficiencies, and B, you need them for the durability of these types of programs that do make these long-term investments that will outlive any election cycles. So, first of all, you need to find and enroll your kids. So whether you have eligibility criteria or not, Maine uses vital records, so does California. Other programs use school districts. Other programs are tied to, if they're enrolled by Medicaid, then Medicaid is the agency that collects that data. So that's the sort of like piece that we sometimes gloss over, but it's actually a really important one, is like, how are you actually going to find these kids? And then how are you going to tell the families about this program? And who is that messenger, right? So in Connecticut, and David, correct me, but it's a form that gets given at the hospital that says, you still kind of have to opt in, but it's in the paperwork that new mothers get when they have their kid. And it's often being delivered by that medical professional who that mother already has a relationship with. And so I think thinking about the enrollment, even if it's automatic, you still have to have some communication, because otherwise the families don't know that these things exist. So obviously then you have whoever's storing the money, managing it, who is communicating with the families. In Connecticut, they have something called ambassadors. They're working with local nonprofits to sort of just keep this messaging coming throughout this child's life course. So I think that's an important thing too, is communication is not a one-time, here's your baby bond, talk to you when you're 18, right? It's how do you make that message happen? And to do that, you can take advantage of other programs, so benefits programs, schools' medical offices in California. They do run a program that allows for outside contributions, and Covered California, the medical system actually gives money into kids' accounts when they show up for their pediatric appointments. So there's all sorts of ways that states have like engaged their systems to reach out to families. A couple other just sort of roles, financial education, the wraparound services. How are you making sure that these mothers have diapers? How are you making sure they are connected to the income programs? And then ultimately claims and distribution, and then evaluation too. So who are your sort of university partners, academic partners who can help you sort of make sure that you're enrolling all the kids that you want to be?
Yeah, great point. Thank you. Let's do one more round robin here, and then we'll open it up to audience Q&A. So let's shift the conversation a little bit on how do we go from pilots to a statewide program, right? We've got the Greater Washington Community Foundation pilot. There's work on a Baltimore City pilot. Maybe, Darius, I'll start with you again. What's kind of where are we in terms of an organizing effort? Obviously, we have our next legislative session coming up in about a month. What's the current status in terms of organizations who are working on this and pulling folks together?
Yeah, well, I'll share that. I'll also share part of what we are doing at this moment with the Brilliant Futures program is running the program, and we have a third-party evaluation firm that is helping us capture both the impact of the program and the process that we're undertaking to do it. So part of this coalition that's coming together of partners, including some up here, to advance this work is about bringing out some of the data that we're seeing on the ground from this current program to share what's possible, what's working, and to even possibly create a playbook that can be used by other nonprofits, community states that want to implement similar programs. But, I'm incredibly grateful. We acknowledged Delegate Mark Edelson at the beginning for his effort on this work, for Comptroller Lierman's effort and continuing to move this forward in a hugely meaningful way. And just eager to sort of be part of this coalition, which I know Tanea is going to share a little bit more about, that's going to be working to move this forward. What we're going to be providing to that, again, is the data that we're seeing on the ground from Brilliant Futures. We also want to contribute some to this idea of what is the potential economic return on this investment that we're making. Treasurer Montoya had a beautiful slide that talked about what the impact could be on the economy in terms of revenue, home ownership, employment, small business starts. And that's something that we want to help make the case for as part of this effort as well.
Great. Thanks. Tanea, you want to talk a little bit more about the coalition?
Yeah, absolutely. So Cash Campaign will continue our conversations around how do we create stability today while also thinking about opportunity for tomorrow. So as Darius mentioned, Cash Campaign, along with the Greater Washington Community Foundation, will be co-leading a coalition to continue our work and efforts around baby bonds, but also talking about other wealth building tools as well. For Cash Campaign, we will continue to take the things that we learned through being the nonprofit administrator for Baltimore's Guaranteed Income Program and apply it to different initiatives as well. So for example, when we led Baltimore's Guaranteed Income Program, it was no strings attached, but throughout the program, after listening to participants and what people wanted, we realized that they actually did want more financial education in classes. We created touch points so that we can continue to check in with families. We listened to the community and we're able to implement the things that they wanted. So that's something that we'll continue to keep in mind as we work on different types of programs as well.
Great, thanks. And Madeline, you've seen this from the national level. We have a lot of other types of groups in the room. We got chambers of commerce. We've got business organizations. Are they part of this? How do other entities kind of reflect or get involved with baby bonds?
Absolutely. I think the strongest way to build, a community around baby bonds in Maryland is for everybody at this event to go talk to 5 people about it, right? I genuinely think everybody here, everybody online has relationships, people who would be interested in understanding that the state is interested in investing in its own kids, right? This is a state that is taking seriously the future of its children, that has done all of this work to model this policy to try to figure out how would we pull off this big bet for the future of our state, the future of our kids. And so I think, philanthropy has a role to play. Darius is obviously here. But I think if the goal is to build sums, right, there are ways to do that without requiring family contributions. But there's no reason why everybody can't take ownership of this program with the state managing it. The financial sector has a role to play here too. We need these families to not just be connected to a baby bond, but also to high quality financial products for the other needs they have in their life. So who are the financial partners who are willing to come to the table with the state and say, sure, we want to provide high quality, low cost personal loans, transaction accounts. You'll see a lot of the child development programs around the country. New York City enrolls 70,000 kids a year. Their bank partner who manages their 529 accounts also manages transaction accounts for their family. So there's ways in which we see partners like that come to the table all over the country. And I think really it's just a matter of an invitation, right? To say this is something we care about. We care about our kids. We want to do this. But we also want to do it in a way that connects these families to all of the other wonderful things happening, the chambers, small business associations, all of those things, and really invite folks to the table to build this coalition.
Yeah, great point. Future customers, right? Well, let's open it up. We got a few minutes left. Any questions in the audience? Okay, well, we got you, and then we got another one behind you. So-
Rabbit again. So I'm just thinking about some of the things that the state has already been investing in, like the Maryland 529. We have a very generous match that happens every single year. And Cash has had, I'll say, a really hard time trying to convince, low-income folks that have very little margin to be able to put money in that for all the obvious reasons. Whereas this, what's exciting is that they can focus on skill building and not have to say, where do I find money in this budget? But at some point, the question will be asked is, we're putting money here in 529, we're putting money in these different places. And I'd just be curious about sort of frames that you may think that may help, like collective impact or other things to say, this isn't this program versus something else. They're all important and additive in their own way. But I just know as policy, maybe not fights, but discussions continue, that sometimes it can be this versus that. And what have we maybe learned from other places so that that doesn't happen?
Yeah, Madeline, you want to go?
Yeah, so a couple things. If you're talking to like a financial sector, people love capital stack, right? Like that's a term that does really well with your sort of like financial chambers, which is, everybody understands, right? Like people have assets in different places, like if you have multiple income streams, right? So it's the same idea, which is these things don't need to work against each other, and instead we really should be thinking about this as a whole package of supports that we have. I also think just at the sort of like example level, there's work that can be done on the front end for families to feel like these things are maybe more integrated than they actually are on the back end. So in California, for example, where they have a 529, they also have a baby bonds program. They're developing what is an app, essentially, such that like anybody who's logging into one of those programs, including SNAP, EBT, is getting links for the other ones as well. And they're just working with a provider to help build out that technology. And they're not actually integrating the accounts on the back end, but they are saying, we understand this is a lot for somebody to manage, right? And there's all sorts of technology now that lets me manage multiple accounts, right? So why not do that for these families as well? Why is it just higher income people who get access to like fancy services, right? So I think there's like practical, and then also just some messaging around like, these things have to work together. This is a whole complete package. And I think just for those of us in the room too, it's like, we have to work together on this too, right? We have to show up. If you're a wealth building person, you have to show up to the income events. You have to show up to these things. We have to work together and act as a field, I think, for people to take this sort of messaging seriously.
Great. Darius or Tanea, you want to add? Okay. Yeah, and I'll just say, in the research we did for the study, we did find that in a lot of other states, a lot of other folks across the country looking at it are looking at, how can you allow for and or encourage baby bonds programs when the young person reaches 18 to maybe be rolled over into a 529 or rolled over into a Roth IRA, either some or part of it or all of it. Great. Well, I think we had one more question in the back here.
Hi, George Berkheimer with the Business Monthly. I know we're just getting into the discussion right now, but people move. Can you explain how these programs affect people who, say, move with a 6-month-old or move into the state with a 6-month-old, or how this works when people move out with children of an older age?
Mm-hmm.
Sure. I'm happy to share specifically for the Brilliant Futures program, which is just one program, but there may be other models. So again, we are working with Jackson Road Elementary and Bradbury Heights Elementary, one in Montgomery County, one in Prince George's County. And the way that it works is each year a student gets a $1,000 deposit. As long as you are enrolled in one of those two school districts, you will continue to get the deposit every year, even if you leave that school, even if you move across from one to the other. If you leave either of those, if you move out of the state, you can still get what has been deposited for you when you sort of turn 18 or graduate. So that's the way that we're approaching it.
The way we approached it for guaranteed income is once a person was in the program, they continue to receive the funding. But I think as we look at it in terms of baby bonds, as David said, it really depends on how the state decides to structure it. I think that we just have to keep in mind in terms of people moving, that people move for a variety of reasons, including the rising cost of living.
Yeah, and I'll just add from the field, residency requirements are a component of all, I think, legislation that I've seen, obviously, except for at the federal level. Some places will say you have to have lived 16 of your 18 years or some number of your 18 years in the state, although, again, forcing people to prove that becomes a little difficult on the administrative side. Other places say as long as you still live in the state when you claim the money, we're not going to worry about what happened in the last 18 years. The other thing I'll just mention is I do think it's important for places to think about, why is it that people are moving and what kind of economy do you have? So something that we testified in DC about was DC had a rule that you had to live in DC, and we know a lot of people move into Maryland, right, and into Virginia, and we have a very regional economy. And so I think being mindful of where are your people moving and why, and does them buying a house just across the border not also impact your economy, right? So like, what is the relationship? And the answer might be no, but there are plenty of places where state lines are less relevant than others. And just one other thing I'll mention on this, foster kids, especially in the DMV, get moved across state lines a lot. And in DC in particular, they get moved to Maryland and Virginia and then sometimes come back. So there are just like particular populations that I think residency requirements are actually really important to pay attention to and to make sure that we're not excluding people who have no choice but to move, are priced out maybe of a neighborhood or are foster children and get placed out without asking for it.
And I'll just share anecdotally, generally, that even in our first 2 years, we're already seeing quite a bit of movement for the students and families. So this is very real, and we don't question why people are moving. We're not, making any sort of, requirement. We just say like what you get into your account, you can get no matter where you are in the future.
Great. I think we have one more question. Two more, maybe. All right. Yep.
Thank you. I think this is excellent that Maryland is taking this road, and I hope that the program is developed and implemented for the next generations. But I have a question that is a little bit different. Is my professional bias. I know in many countries there is a lot of concerns about the very low fertility, and they are trying to do everything in their hands to increase it. I'm working with some countries, for example, of the Balkans, and there is really a huge concern. And they are trying to see what other countries are doing. I understand that the objective of this program has nothing to do directly with this but would you be expecting that this, or is there any experience based on those programs that because of these bonds, fertility and marriage increase? Thank you.
Interesting. Madeline, have you looked at this? Yes, there is. Yeah. Mm-hmm.
Yes, the data does show, the data that we did show that outside of out-migration, the other issue is to help increase for people having children, because then they feel more comfortable and safe that they can afford them.
But fertility rate in New Mexico is still one of the lowest. It's like 1.5 now. A decrease from 2.06, like the level of replacement, in 15 years. So I understand that the impact could be different depending on which group you are dealing with. Maybe in that group that changed. But I would be very interested in knowing, see the results. It will be great to have those results.
Yeah, population growth. One more question, and then we'll wrap up.
Thank you. Hi, my name is Catherine Etman, and I'm an assistant professor in the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. And our aspiration is to create research that's useful to policymakers. So I'd love to hear where you think there are gaps in the evidence or what type of research or data or scholarship would be helpful to the cause.
One of the things that we haven't talked about a ton today is the body of work that looks at early childhood outcomes when this money is given, which is robust, actually, though there's always more to do. But really interesting studies looking at maternal and parental stress, relationship between parent and child, kindergarten readiness, preschool attendance, And I think what's powerful is that those are programs they are savings programs, but they don't allow for withdrawals without penalty, right? So this is just the money sitting there. This isn't actually materially changing anything for those families. It's just the knowledge that there is money set aside for your kid. And so I think the research around like optimism is still pretty underdeveloped, and I think is really relevant to this field, especially as we try to convince policymakers who will likely not be policymakers anymore when these kids get these dollars, right? But is like, this is really also a policy about like hope and future looking and optimism, and those are hard things to measure. But I think the more that we can try to dig into some of that, the stronger our research base will be, but also I think that's very, I think that's in the national conversation a lot right now, right? Which is, how do we set up an environment where especially our low-income families feel optimistic about their futures?
I know for me, I would like to see more research around the impact on mental health and looking at things around like less household chaos, how parents feel raising their children, knowing that there's things in place like baby bonds and other programs as well.
Yeah, and for me, it's quite similar. I mean, for Brilliant Futures, we are measuring and looking at things like academic achievement or attendance. We do want to measure this idea of sort of like young people dreaming or dreaming bigger, or sort of knowing that they have this resource in the future that they can use to achieve their dreams. All of these things around mental health, physical health, we're seeing positive outcomes when it comes to guaranteed income, both in our program and our Thrive program, and in others as well. So that's an area that we hope to measure more of in Brilliant Futures. And then finally, again, going back to the economic impact of these programs down the road. So in 2036, 37, and 38, when the students at Jackson Road and Bradbury Heights redeem these funds and use them to buy homes or start businesses or, pursue higher education, we want to really understand what impact that's having here in Maryland and in their communities.
Yeah, and I'll just add on to that. What we did not include in this study that we did is the long-term economic impacts as it relates to state income revenue coming in, as it relates to spending on social services in the state budget, and also as it relates to other things relating to home ownership growth or business startup growth. That is something that New Mexico has looked at. They worked with an econometrics firm, Echo Northwest, to do some of the data that the treasurer reported on earlier, but that's another area that could be of interest. So great. Well, we're right at 3 o'clock. Madeline, you've got one last word here.
I was just going to say, long-term evaluations are really hard. Wealth is a really hard thing to evaluate because it happens over time. At the state level, longitudinal data sets are this huge resource, right, that we don't get in some of these pilots. So just a nod to like working with your state universities who have access, and you can kind of do some linking there, your health system. But just like, that's a real benefit of a statewide program or a program operated by the state, is you potentially have access to other agencies' data sets, which lets you do that sort of long-term tracking without needing to fund an evaluator for 30 years.
Great, thank you. Well, let's give these guys a round of applause. Thank you so much. In closing, I just want to give a shout out to our team who worked on the report: Danny DePietro, Andy Alexander, Devon Blackburn, and Matt Dudzik. It was really a team effort, and we really kind of worked tirelessly in the last few weeks to get this done. And finally, thank you guys for coming. Hope everyone learned something. Thanks everyone on the live stream. We look forward to following up and continuing the conversation with all of you. Have a great rest of your week. Thank you.